Azelaic acid gel is used to treat a skin condition called rosacea by reducing the number of inflamed skin lesions. It is typically applied to the affected areas twice a day, in the morning and evening. It is important to follow the instructions from your doctor or pharmacist for the best results. This medication is specifically for use on the skin. Before applying the gel, make sure to clean the affected area with a mild soap or soap-free cleanser and pat it dry. Your doctor will instruct you on how to apply it, but usually, it's applied twice daily. Gently massage the medication into the affected area and wash your hands well afterwards. You can apply makeup after the medication has dried. Be careful to avoid getting any of the gel in your eyes, nose, or mouth. If it does get in your eyes, wash them immediately with plenty of water and contact your doctor if eye irritation persists. It's important not to use larger amounts or apply the gel more frequently than directed, as it won't help your condition clear faster and may increase the chance of side effects. Improvement is typically seen within 4 weeks, but it may take several weeks of continued use to see the full effects. If your symptoms do not improve or get worse, be sure to inform your doctor. And remember, do not apply any dressing or covering over the treated area unless directed by your doctor. During the first few weeks of using azelaic acid gel, you may experience burning, stinging, tingling, or itching skin, but these effects should lessen as your body gets used to the medication. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, you should immediately contact your doctor if you experience any serious side effects, such as worsening asthma symptoms or abnormal changes in skin color. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms like rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for guidance. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using azelaic acid gel, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have asthma. Avoid consuming foods or liquids that may cause redness or flushing of the skin, such as spicy foods, alcohol, or hot drinks. If you are planning to have surgery, inform your doctor or dentist about all the medications and products you are using. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it may pass into breast milk. When using azelaic acid gel, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. In addition, it's best to avoid using skin care products that could cause further irritation, such as cleansers containing alcohol, tinctures, astringents, abrasives, and peeling agents. If you have any concerns about potential interactions or irritants, consult your doctor or pharmacist for more details. When using azelaic acid gel, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. In addition, it's best to avoid using skin care products that could cause further irritation, such as cleansers containing alcohol, tinctures, astringents, abrasives, and peeling agents. If you have any concerns about potential interactions or irritants, consult your doctor or pharmacist for more details. If this medication is swallowed, it could be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to seek emergency help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is for use on the skin only. Do not apply to the inner lip area or inside the nose/mouth. If this medication gets in your eyes, nose, mouth, or on your skin, wash the area immediately with plenty of water. If irritation occurs, contact your doctor right away. If you forget to use a dose of azelaic acid gel, use it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and continue with your regular dosing schedule. Don't take a double dose to make up for the missed one. Make sure to store azelaic acid gel at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.